Okay, so you've given us some really important stuff to dive into today.
Yeah.
This is about preeclampsia and eclampsia. We really want to get this right.
Right.
So we're going to take your articles, your notes, and try to pull out what matters most here so we can really understand these conditions. What do you think?
I think that's a great idea. Absolutely. And, it's so important because preeclampsia is a huge global health concern.
Right.
It's a leading cause of death and serious illness in pregnant women. So we really need to know what we're dealing with here.
Absolutely. So, from what I'm seeing in your notes, preeclampsia is basically defined as having high blood pressure for the first time during pregnancy.
Right.
They call it new onset hypertension, along with either protein in your urine, proteinuria,
Huh?
or some kind of problem with how your organs are working.
Right.
This can affect your heart, blood vessels, liver, kidneys, even your brain
Mhm.
and nervous system.
That's scary stuff.
It is scary stuff. And, the thing is, it can come on with or without these really severe features, right?
Yeah, that's a really important point.
Hmm.
And the root of preeclampsia, like your sources explain, it all starts with problems in the placenta.
Okay.
This isn't just about high blood pressure in the mother. It's about how the placenta develops and supports the pregnancy.
So let's break down this whole placenta thing.
Yeah.
What should normal development look like?
Yeah.
And then where does it kind of go wrong in preeclampsia?
So in a normal pregnancy,
Hmm.
the spiral arteries in the placenta, they kind of go through this big change, right?
Okay.
They widen out, they become thinner, they have a larger diameter.
Okay.
And that lets them handle all that extra blood volume that's needed to nourish the growing baby.
Makes sense.
It's like going from a small country road to this major highway
Yeah.
to accommodate all that traffic.
Yeah, that's a really good way to put it. More room for the blood to flow.
Exactly. But with preeclampsia, this whole remodeling process, it doesn't happen like it should. Either it doesn't happen fully or it only happens partially. And that causes decreased blood flow to the placenta. We call that reduced placental perfusion.
Okay.
And it also means less oxygen is getting to the placenta, which is hypoxia.
And it sounds like that lack of oxygen, that decreased blood flow, that's kind of the starting point for a lot of the other issues, right?
Exactly. Your sources say that this placental ischemia, it leads to the release of these, they call them toxic substances.
Yeah.
But, think of it as the placenta kind of freaking out a little bit.
Yeah.
It's sending out this SOS signal, but the mother's body is not understanding it correctly. And these substances, they end up damaging the cells that line the blood vessels all over the mother's body. It's called endothelial cell dysfunction.
So now we have damaged blood vessel linings. How does that turn into high blood pressure?
Okay, imagine these blood vessel linings. They're irritated, they're less flexible,
Okay.
and what happens? They start to narrow. This is what we call vasospasm. All the blood vessels are basically squeezing down, making it much harder for the blood to flow.
Oh, I see.
That directly leads to high blood pressure or hypertension, which is like the big sign of preeclampsia.
Right.
And because it's happening everywhere, all the mother's organs can suffer from this poor blood flow.
Wow. Okay. So we have a placenta that's not getting enough blood.
Right.
It starts sending out these signals that damage blood vessels. Then those vessels clamp down, causing high blood pressure and affecting everything else.
Exactly.
Okay, that makes the whole process much clearer. So what can be done about this? What do we do to manage it?
Okay, let's start with prevention.
Okay.
Can we stop this from happening in the first place?
Right.
Your sources highlight a few key areas for prevention. It starts even before pregnancy with preconception counseling, especially for women who are at higher risk.
Okay.
Then, throughout the pregnancy, careful management and monitoring of blood pressure is super important.
I also noticed in the material you gave me that aspirin can be used to prevent preeclampsia.
Yeah, you're right. Prenatal aspirin therapy is a big preventive strategy
Okay.
for some women.
Okay.
It involves taking a low dose of aspirin, like 81 milligrams every day, starting around 12 weeks of pregnancy and continuing till delivery.
Okay.
They usually recommend this for women who have one or more risk factors for preeclampsia. And your sources actually cite a study by Wang and his colleagues, I think it was from 2022,
Okay.
that supports this approach.
So that's good to know. If you're in that high-risk category, low-dose aspirin might be something to consider.
Yeah, for sure.
Let's talk about managing preeclampsia once it's actually diagnosed,
Okay.
starting with cases that don't have those really severe features.
Right. So let's say someone's diagnosed with preeclampsia, but they're not showing signs of like major organ problems or blood clotting issues.
Okay.
The first approach is to try to manage it conservatively.
Okay.
If their blood pressure is only a little high, they might be able to stay home
Yeah.
with instructions for bed rest. Regular blood pressure checks and keeping track of the baby's movements. which is like counting the baby's kicks.
Okay, so a more cautious approach, just watching and waiting at first. What else does managing these milder cases involve?
Well, monitoring their labs regularly is really important.
Okay.
Checking their blood counts, seeing how their blood is clotting, looking at their liver enzyme levels, and watching their platelet counts.
Okay.
That helps the doctors make sure things aren't getting worse.
Right?
But if managing at home isn't working
Yeah.
and their blood pressure isn't going down, then they'll need to be hospitalized.
Okay.
And at that point, the treatment gets more individualized based on how severe the preeclampsia is and how far along the pregnancy is.
And if someone with non-severe preeclampsia is in the hospital, what kind of monitoring happens? Like, what are they checking all the time?
The main thing is to watch for any signs that the preeclampsia is getting worse or that it might turn into eclampsia, or which is when seizures start happening. So they'll be looking for things like bad headaches that don't go away, increased reflexes, what doctors call hyperreflexia.
Okay.
They'll be checking her blood pressure all the time
You're right.
and constantly monitoring the baby too.
Okay. One term that came up in the stuff you sent me was expectant management.
Yeah.
What does that mean in this situation?
It basically means watchful waiting in the hospital.
Okay.
They often do this if the pregnancy hasn't reached 37 weeks yet, if the baby's lungs aren't mature enough to be born, and if there are no other problems that need immediate delivery.
Okay.
The goal is to give the baby more time to develop while they control the preeclampsia.
Got it. So what about when labor starts for someone with preeclampsia without severe features?
Okay.
How is that handled?
The main thing is to keep the preeclampsia from getting worse during labor.
Okay.
So they'll still be checking her blood pressure very often.
Mhm.
And it's important to keep things calm and quiet, right?
To reduce stress.
Exactly. They'll also be watching her neurological status really closely,
Okay.
and they'll usually put in a catheter to track her urine output accurately.
Okay. That makes sense. So that's managing preeclampsia without severe features.
Right.
Now, what about when things are more serious, when there are severe features? What are the signs that it's a more severe case?
Well, those severe features can come on really fast,
Oh.
sometimes within hours or just a few days.
Really?
Yeah. Some of the key signs are a blood pressure reading of 106 on 110 or higher,
Okay.
a really bad headache that doesn't go away, vision problems like blurry vision or seeing spots, fluid in the lungs, which we call pulmonary edema,
Okay.
severe pain in the upper right part of the abdomen, signs that her liver isn't working right, a low platelet count, that's called thrombocytopenia,
Okay.
and signs that her kidneys are getting worse.
Wow. That sounds really serious. Like it needs immediate attention. What happens when someone comes in with those severe features?
They need to be hospitalized right away. And the treatment gets a lot more aggressive at that point.
Okay.
The goals are to stabilize both the mother and the baby.
Right.
Get ready for the birth, get the high blood pressure under control,
Okay.
prevent seizures, make sure the baby is delivered at the right time, and prevent any long-term complications or death for either of them.
And what kind of treatment and monitoring do they get in the hospital for severe preeclampsia?
Okay, so from what you've shared, it sounds like they start with really intense monitoring of both the mother and the baby. And that starts right when they're admitted and continues the whole time they're there. They use medications to lower the blood pressure,
Okay.
and they also give magnesium sulfate intravenously through a pump to prevent seizures.
Okay.
It's important to know that magnesium sulfate can sometimes cause the baby's heart rate to vary less. So the doctors will be watching for that.
Okay. And what's the usual approach to delivery in cases of severe preeclampsia?
If possible, they prefer a vaginal delivery, as it generally leads to better outcomes for the mother.
Okay.
Sometimes they'll use medications like a PGE2 gel to help the cervix get ready for labor. But if the mother's really sick or there are concerns about the baby, they might need to do a cesarean section to get the baby out quickly.
Okay.
In those cases, it's important to have a pediatrician or a neonatologist there for the birth,
Right.
because the baby might have some issues like breathing problems, low muscle tone, or low calcium levels
Wow.
because of the high doses of magnesium the mother received.
Okay. That makes sense. Now let's talk about eclampsia. You mentioned it earlier.
Yes.
It's considered a neurological complication of preeclampsia.
Right.
What exactly is it?
Eclampsia is when someone with preeclampsia starts having seizures.
Okay.
And not just any seizures, but generalized tonic-clonic seizures.
And those are the ones where they lose consciousness.
Exactly.
And their muscles stiffen and jerk.
Yes, and your sources are very clear that eclamptic seizures are a true medical emergency.
Wow.
It needs immediate treatment because it can be fatal for both the mother and the baby.
That's terrifying.
It is.
So what do they do right away when someone has an eclamptic seizure?
The most important thing is to control the seizure and prevent more seizures.
Okay.
They'll usually keep giving magnesium sulfate intravenously for at least 24 hours after the last seizure.
Okay.
Then, once the seizures are under control and the mother is stable, the next step is usually to deliver the baby, either by inducing labor or doing a C-section.
Okay.
Actually, there was this study by August and Sebai in 2023 that you included in your materials that talks about this.
Oh, okay.
They basically say that once things are stable, getting the baby delivered is the next priority.
And what happens after the baby is born if the mother had eclampsia?
Well, if she's stable after the delivery,
Yeah.
they'll probably move her to the postpartum unit for continued care.
Okay.
But if she's still unstable or gets worse after giving birth,
Yeah.
she might have to go to the intensive care unit where they can monitor her more closely.
Okay, so we've talked about what causes preeclampsia and eclampsia, how they're managed at different levels of severity.
Right.
Now let's talk about how nurses play a role in all of this.
Okay.
How do they spot these conditions early and watch for them to get worse? What are some of the key things they look for?
Your sources are really big on nursing assessment.
Okay.
They say it's absolutely crucial to prevent serious problems. Nurses are like advocates for their patients, and they provide really important counseling.
Right.
But a big part of this is simply taking an accurate blood pressure at every single visit.
Okay.
Nurses also need to be really tuned in to anything the pregnant woman says that might be a sign of trouble, like vision changes, bad headaches, unusual bleeding or bruising, or pain in the upper right part of her belly.
And the sources also pointed out that sometimes the woman might not even notice the high blood pressure or the protein in her urine at first.
Exactly. And by the time she starts feeling symptoms, it could be really serious.
Wow.
That's why it's so important for healthcare providers to be checking these things regularly.
So what are the actual criteria for diagnosing preeclampsia?
Well, it's not just one high blood pressure reading.
Okay.
It has to be a sustained high blood pressure.
Okay.
Specifically, a blood pressure of 14D90 or higher, measured twice at least 4 to 6 hours apart.
Okay.
And they also need to find protein in her urine,
Okay.
either 300 milligrams or more in a 24-hour urine collection, or a certain level on a dipstick test of 2 random urine samples taken at least 4 to 6 hours apart.
Okay.
And importantly, they need to make sure it's not a urinary tract infection causing the protein in the urine.
Okay. So it's not just a one-time thing. It's a pattern of high blood pressure along with protein in the urine.
Exactly.
Or signs that other organs are involved.
Exactly.
So how about figuring out who's at higher risk for preeclampsia in the first place? What are the things nurses look for when they first meet a pregnant woman?
Taking a detailed medical history at the very first prenatal visit is so important for figuring out who might be at higher risk.
Okay.
Your sources list a bunch of risk factors, like being pregnant for the first time,
What?
being younger than 20 or older than 35, being overweight or obese before getting pregnant,
Okay.
having had preeclampsia in a previous pregnancy,
Right.
having had problems with the placenta in a previous pregnancy,
Uh-huh.
having a history of things like diabetes, high blood pressure, kidney disease, lupus, or antiphospholipid syndrome,
Okay.
having conceived using assisted reproductive technology,
Uh-huh.
being pregnant with multiples like twins or triplets,
Yeah.
and having a family history of preeclampsia, especially in a close relative like your mother or sister.
So that's a lot of potential risk factors. What happens if they find out a woman is at higher risk?
If someone's considered high risk, they usually need more frequent prenatal visits throughout their pregnancy. And they also need to learn all about the signs and symptoms of preeclampsia so they can report any problems right away.
Right.
They also emphasize the importance of taking blood pressure very carefully at each visit,
Uh-huh.
like using the same position every time, either sitting or lying on her side with her arm at heart level,
Okay.
using the same method, whether it's an automatic machine or a manual one,
Right.
and making sure the equipment is calibrated correctly.
Okay.
At each visit, they'll also check her urine for protein using a dipstick,
Uh-huh.
and they'll listen to the baby's heartbeat with a Doppler.
Right.
It's standard practice.
And what about weight gain and swelling? I saw something about that in the materials.
Yeah, they definitely watch for any sudden big weight gains
Okay.
because it could be a sign of fluid retention. They also look for swelling in places like the face and hands, not just the legs and feet, which is more common in pregnancy.
Okay.
And depending on the woman's risk factors and what they find during the exam, they might order some blood tests like a complete blood count, electrolytes, BUN, and creatinine to check kidney function,
Okay.
and liver enzymes. If the dipstick shows a certain level of protein, they might do a 24-hour urine collection to measure the total protein more accurately.
Okay, so they're really looking at a lot of different things to get the full picture. Now let's talk about what nurses actually do to manage preeclampsia. What are some of the key interventions?
The big things are watching the blood pressure really closely
Okay.
and always looking for any signs that the condition is getting worse.
Right.
And they have to keep a close eye on the baby throughout the whole pregnancy, too.
Okay. So for someone who has preeclampsia without severe features and might be able to stay home,
Right.
what do nurses do for them?
Well, for those women, home management is often possible,
Okay.
but it's still all about careful monitoring. Nurses have to teach the patient and her family about preeclampsia,
Right.
how to check her blood pressure correctly at home, and what signs and symptoms to watch out for. They really emphasize that she needs to call her doctor immediately if anything changes, or if she has any of those warning signs.
So what are some of the things they tell her to watch out for at home?
Okay, so they give her a whole list of things like resting in a quiet place, drinking enough water, eating healthy foods with lots of protein and fiber,
Okay.
taking some time to rest in bed, not doing anything too strenuous,
Yeah.
and getting help from her family or friends so she can get enough rest. They also teach her how to monitor herself, like how to take her blood pressure twice a day at the same time each day,
Okay.
and how to count the baby's movements every day.
Okay.
And really importantly, they give her a list of danger signs. That means she needs to call her home health nurse or doctor right away.
And what are some of those danger signs?
Okay, let me see. They tell her to call if her blood pressure goes up a lot,
Uh-huh.
if she has burning or has to pee more often,
Yeah.
if the baby's movements decrease, if she gets a bad headache, especially in her forehead or the back of her neck,
Right.
if she feels dizzy or her vision changes, like things get blurry or she sees spots,
Uh-huh.
if she has stomach pain, bad heartburn, or pain in the upper right part of her belly,
Okay.
if she's not peeing as much,
Right.
if she starts having contractions or bad back pain,
Yeah.
if she bruises easily,
Wow.
if she suddenly has bad abdominal pain, or if she keeps feeling nauseous or vomiting.
So many things to be aware of. What does the home care nurse do for her?
The home care nurse is really important.
Yeah.
They visit the patient at home.
Uh-huh.
They call her regularly to see how she's doing.
Right.
They help arrange for tests like non-stress tests to check on the baby.
Okay.
And they're always looking for any signs that the preeclampsia might be getting worse.
Yeah.
The sources say that catching things early and treating them quickly leads to the best outcomes.
That makes sense.
Of course, if it does get worse at home, she'll need to go to the hospital.
Yeah.
But even in the hospital, if it's mild preeclampsia, they try to keep things calm and quiet for her to help her rest.
Okay. What about managing someone who's in the hospital with severe features of preeclampsia? That sounds a lot more intense.
It is. If someone has severe preeclampsia,
Yeah?
they usually have to stay in bed, often lying on their left side to help blood flow to the uterus.
Okay.
They keep her room dim and quiet to minimize stimulation,
Uh-huh.
and the doctor might order sedatives to help her rest.
Okay.
Because the risk of seizures is so much higher now, they take a lot of precautions.
Right.
They put padding on the side rails of the bed to prevent injuries if she has a seizure.
Okay.
They make sure there's oxygen and suction equipment ready at the bedside.
Wow.
And she always has her call button nearby so she can call for help easily.
It makes sense. And the sources mention that severe preeclampsia makes other problems more likely too. Things like the placenta separating from the uterus too early, preterm birth, the baby not growing enough in the womb, and fetal distress. Wow, that's scary. So nurses have to be extra vigilant in those situations, right?
Absolutely.
What are some of the specific things they do to care for her?
Well, they watch her blood pressure constantly
Okay.
and give her blood pressure medications as ordered by the doctor.
Uh-huh.
They check her vision and how alert she is regularly.
Okay.
And they'll report any changes or if she complains of a headache or vision problems.
Right.
Making sure she gets enough nutrition is important too.
Yeah.
So they usually encourage her to eat a high-protein diet and drink plenty of fluids.
Makes sense.
Nurses also keep track of exactly how much fluid she's taking in and putting out,
Mm-hmm.
and they give her IV fluids and electrolytes as ordered.
Okay.
They also have to be on the lookout for signs of pulmonary edema, like shortness of breath, low oxygen levels, coughing, and crackling sounds in her lungs. If that happens, they'll need to act fast. They'll also help her get ready for any tests the doctor orders to check on the baby,
Okay.
like non-stress tests, ultrasounds to measure the baby's growth, and biophysical profiles.
And what about the magnesium sulfate we talked about before? How do they manage that?
Giving magnesium sulfate through an IV is really important for preventing seizures and severe preeclampsia.
Right.
Nurses check the patient's reflexes regularly to see if the magnesium is working and to make sure she's not getting too much of it.
Okay.
In severe preeclampsia, it's common for her reflexes to be stronger than usual. But if they start to get weaker or disappear, it could be a sign that she has too much magnesium in her system.
Oh, wow.
The sources mentioned something called the NINDS reflex scale,
Okay.
which is a way to grade how strong the reflexes are.
Okay.
Nurses also need to know that calcium gluconate can reverse the effects of too much magnesium, and they need to be ready to give it if necessary.
That's good to know. So they're constantly monitoring the baby's heartbeat too, right?
Yes, absolutely. They use electronic fetal monitoring to keep a close eye on the baby's well-being,
Okay.
and they watch for any signs that labor might be starting.
Right.
If the doctor decides to induce labor, they'll get everything ready for that.
Okay.
And of course, a big part of nursing care is providing emotional support to the patient and her family,
Yeah.
keeping them informed about what's going on, listening to their concerns, and reassuring them. This is a really stressful situation.
It sounds like it. So we've covered a lot about managing severe preeclampsia. What about when someone actually has an eclamptic seizure? What are the priorities then?
Okay, so if a seizure happens, the absolute top priority is the patient's safety.
Okay.
If they can, the nurse will gently turn the patient onto her side so she can breathe easier.
Okay.
And they'll stay right there with her throughout the whole seizure. They also make sure the side rails are up and padded,
Yeah.
and they try to keep the room as quiet and dark as possible.
Yeah.
As soon as the seizure is over, the nurse will carefully write down exactly when it started and stopped and what happened during the seizure.
Okay.
They might suction out her nose and mouth if needed
Okay.
and give her oxygen.
Right.
They'll keep giving her magnesium sulfate to prevent more seizures,
Okay.
and they'll keep monitoring the baby's heartbeat.
Yeah.
They'll also check for any signs of labor
Okay.
because it might have started. They'll get her ready for delivery as soon as it's safe because that's usually the best thing to do for both the mother and the baby
Right.
once things have calmed down a bit.
Okay. Lastly, let's talk about what happens after delivery for someone who's had preeclampsia or eclampsia.
Okay.
What kind of care do they need?
The close monitoring continues for at least 48 hours after the baby is born.
Okay.
If she was getting magnesium sulfate,
Yeah.
they'll usually keep that going for about 24 hours after the birth,
Okay.
and they'll check her magnesium levels during that time. They'll check her vital signs like her blood pressure, pulse, temperature, and breathing every 4 hours. And they'll do all the usual postpartum checks like checking her uterus, the bleeding, her breasts, making sure she can pee,
Right.
checking her bowels, and how she's feeling emotionally.
Okay.
Watching her urine output is really important too.
Yeah.
Because if she starts peeing a lot more and the protein in her urine goes down,
Yeah.
it's a good sign that preeclampsia is resolving.
Okay. So to sum up, what are the main things we've learned today about preeclampsia and eclampsia based on all the information you gave us?
So we talked about how these conditions start with problems in the placenta during pregnancy,
Right.
and that sets off a chain reaction leading to high blood pressure and potential damage to the mother's organs.
Yeah.
We covered how the management changes depending on how severe it is, from careful monitoring at home for mild cases
Right.
to intensive treatment in the hospital for severe cases.
Okay. And nurses play a huge role in spotting these conditions early and managing them effectively.
Exactly. They're really at the front line. And their assessments and care are so important for both the mother and the baby. It's almost like the placenta is sending out a distress signal,
Right.
and the mother's body is overreacting to it,
Yeah.
causing all these problems.
It's a delicate balance for sure. Well, this has been incredibly helpful. All the information you brought, the articles, the notes, it's really given us a good understanding of these complex conditions and how important healthcare providers are in managing them. So thank you for that.
Of course.
Yeah.
It really makes you think, when you see how closely connected the placenta and the mother's body are and how things can go wrong in preeclampsia, it makes you wonder, could there be other conditions, maybe even ones that happen outside of pregnancy, that are caused by similar problems with how blood vessels adapt to changes?
That's a really interesting question, something to definitely ponder.
Definitely.
Well, thanks again for bringing all this information. It's been a fascinating deep dive.
My pleasure.
And to all our listeners, thanks for joining us on the deep dive. Until next time.
Bye, everyone.